a little boy who we saw in the clinic once, and we had just made a diagnosis of eye cancer. Now, this was in the early stages, and his father was the one who brought him into hospital. And basically, this was the first time he was, first of all, hearing about this kind of illness. They knew something was wrong with their son, but he didn't know what exactly it was. And we're saying that his son needed a life-changing surgery because the surgery had the potential of removing the growth early enough so that the cancer wouldn't spread and take his life. Now, the bill for this surgery, because it was in a government hospital, was 20,000, including admission fees. And I looked at this man and I saw him visibly break down and start crying because he just couldn't imagine where this 20,000 naira was going to come from. Just seeing this man who works for a living cry at the thought of losing his son for 20,000 naira was just heartbreaking. And between myself and my colleagues who were on the team, we contributed and paid for that service for his son. The tumor was taken out and he made recovery and they went back home. A month later, probably because of poor hygiene, environmental circumstances, his son had an infection and they went to a chemist or something. The long and short is this boy died. First of all, he didn't have the money to pay for the surgery in the first place for his son. The money was raised and his son got that surgery. When his son was having signs of infection, he probably thought, if I go to hospital now, how much will they ask me for? And, he decided that the cheapest option for him was to go to a roadside chemist. They gave him medications which obviously he could afford, he paid for, but they obviously were not the right medications. And his son died from an infection which could have been treated if he had come into a hospital and had access to quality, safe, comprehensive care. This is just one of so many stories that I come across, I hear from colleagues, and it doesn't have to be the case. Universal health coverage is a financing system where every single citizen or resident in a country has access to safe, quality and comprehensive health care without wondering how they're going to pay for it. And it's sad that in Nigeria, the reality for so many, the majority of people in the country, is that when they have these healthcare challenges, they have to raise money to pay for their healthcare. As a country, it sends a message to almost 180 million plus citizens that our lives don't matter. We can die from any infection, from the water we drink, from the food we eat, from where we live, and we don't have access to care unless we have the money that would pay for that healthcare in our pockets. It's not sustainable, and that is the tragedy of the lack of universal health coverage in Nigeria. We all have to lend our voices to universal health coverage. It's not a choice. It's a task. It's a responsibility as a country. Nobody plans to be sick. Nobody plans to have an accident. This can happen to anyone at any time. Every single moment that is spent sick in a hospital bed or looking for money to attend to a healthcare challenge is time spent away from progress and development. Our lives have to matter. And this is why I push for universal health coverage. I'm Dr. Adaeze Oreh. I'm a universal health coverage advocate.